We all want that luscious, silky smooth, bald head, right? Wait, no, that can't be right. We all want that luscious, silky smooth, full head of hair, right?
Absolutely, I do.
Unfortunately, 50% of men past 50 are bald, so we need to counter that. Many companies like Hims, Nutrafol, Happy Head have come alive to solve this one problem. My name is Eman Janasani. I am a licensed pharmacist in California, and in this video, I will be discussing how Finasteride works, topical finasteride versus oral finasteride, dosing, and side effects. So let's get started. First, let's go over how finasteride works in terms of mechanism. Testosterone, the hormone known for its role in muscle growth and energy, is converted into dihydrotestosterone, abbreviated as DHT, by an enzyme called 5-alpha reductase. DHT is actually more potent than testosterone and has a special affinity for hair follicles. When too much DHT binds to receptors in your hair follicles, it shrinks them, makes the hair thinner and weaker. Over time, this miniaturization process can lead to the follicles closing up shop altogether, resulting in hair loss, especially in areas like the temples and crown. So it's like DHT is the uninvited guest at a party, overstaying its welcome and driving everyone away. Only in this case, the guests are your hair strands. Finasteride works like a bouncer at the DHT party. It steps in to block the enzyme 5-alpha reductase, the one responsible for turning testosterone into DHT in the first place. By inhibiting this enzyme, finasteride effectively lowers the amount of DHT circulating in your body. With less DHT around to bind to hair follicles, the hair thinning process slows down or even stops altogether. This gives your hair follicles a chance to recover and produce thicker, healthier hair, and we all want that, right?
Absolutely, I do.
Essentially, finasteride reduces DHT levels, which helps keep your hair intact and gives your follicles a fighting chance. Now, remember, high amounts of DHT in the scalp can cause that hair thinning, but DHT is all over the place, not just in the scalp. So we want to target the scalp DHT if we can and lower that to reduce hair thinning on the head and minimize side effects systemically by not decreasing DHT overall in the body. I will go over how we can do that in a little bit, but first let's go over dosing. Normal dosing for oral finasteride that has been extensively studied is 1 milligram per day. When taking finasteride, the studies show that 90% of men will have their hairline stabilized after 1 year of taking finasteride. That means that 9 out of 10 males won't be losing their hair 1 year after taking the medication. Very good results. However, the drug doesn't last or work forever for most people, because after 5 years, 66% of men have their hair loss stabilized. Still good results, but obviously much lower than 90%. This doesn't mean that it is useless in 33% of men. It just means that for those men, the hair loss will occur with or without the drug. It's just that the drug will delay the time it takes for the hair loss to occur, which is still a desirable result for most men. Recently, physicians have found that lower doses have worked just as well for their patients while also reducing side effects. However, this is mostly anecdotal and not confirmed by large studies, so the best way to go about dosing is to stick to the 1 milligram daily dose, and if side effects start to become a problem for you, you can lower the dose by taking a half tablet every day or 1 tablet every 3 days or whatever protocol you choose with your physician. I wouldn't just start with a lower dose in order to try and avoid side effects from the beginning, because the side effect rate is actually less than 10% for the 1 milligram of oral finasteride, so the chance is already low, and we know that the effective dose in the studies was 1 milligram, so we should stick to that dose if we can. Remember, 5 milligrams of finasteride is for benign prostatic hyperplasia, so we don't want that dose for hair thinning. Now let's discuss finasteride formulations. Oral and topical finasteride are two different forms of the same medication, both designed to reduce DHT levels, but work in slightly different ways and have distinct effects. When you take finasteride in pill form, it enters your bloodstream and circulates throughout your entire body. This systemic approach means it reduces DHT levels everywhere, including in your hair follicles and other parts of your body, like the prostate. This broad effect is why oral finasteride is often prescribed for both hair loss and conditions like benign prostatic hyperplasia, which is a non-cancerous enlargement of the prostate gland that I mentioned before with the higher dose of 5 milligrams. The downside, though, is that because it affects DHT levels body-wide, it can cause side effects like decreased libido, erectile dysfunction, and sometimes mood changes in a small percentage of users. Again, for the 1 milligram dose of finasteride, these side effects occur in about 5 to 10% of users, and for the 5 milligram dose, that percentage jumps up to 15 to 20%. Luckily for hair loss, we use the 1 milligram dose, so the side effect occurrence is pretty small. In contrast, topical finasteride is applied directly to the scalp where it's absorbed locally. The goal with this form is to target the DHT levels specifically in the scalp, reducing them right at the source of hair loss without affecting DHT levels in the rest of the body. This more localized treatment aims to minimize the systemic side effects associated with oral finasteride. However, since it's applied directly to the scalp, it may be less convenient for some users compared to just taking a pill. Also, it's very easy to overdo or underdo the dose, causing an inconsistency in the dosage amount on a day-to-day basis. And to make things worse, if you overdo it, then that extra finasteride can travel to the rest of the body and reduce DHT levels everywhere, making it essentially the same as just taking the oral form, just more inconvenient. The goal here is to just drop a few droplets of the medication on the bald spots of your head, isolate the effect of the medication, and keep it in just that area that we need it to work in. In theory, topical finasteride should work the same as oral finasteride with less side effects, since the effects of the medication should stay in the scalp area where we are applying it versus going through the bloodstream where we can take it by mouth. Does the research back this up though? There was a study done recently that compared 0.2 milliliters of 0.025% topical finasteride versus 1 milligram oral finasteride versus placebo. The results here show that both topical finasteride and oral finasteride were way more effective than placebo. However, they were not different in efficacy when compared to each other. In terms of side effects though, topical finasteride had way less side effect occurrence. This is obviously desirable as we want to only target scalp DHT and reduce that so that we get the less shedding of hair while minimizing serum DHT exposure, which should lead to less side effects. From this graph, we can see that topical finasteride reduced DHT levels by about 34%, while oral finasteride reduced serum DHT levels by about 55%. Again, less reduction of serum DHT is better as that will lead to less side effects. We want to target scalp DHT. Now, the question on if you should take topical or oral finasteride. They both seem to have similar efficacy, but topical finasteride having less side effects. However, the issue we have here is that topical finasteride doesn't have long-term data. With oral finasteride, we have data showing that after 1 year, 90% of men had less balding and 66% after 5 years. The topical finasteride study I referenced earlier only lasted 24 weeks total, which is a half a year. We have no idea if it remains to be as effective as oral finasteride after 1 year, 2 years, 5 years, and so on. Hair loss is a long-term problem. I would not recommend starting with topical finasteride and risking quicker hair thinning versus oral finasteride when you don't even know if you will experience any bad side effects from the regular 1 milligram oral finasteride protocol from the get-go. The way I would do it is I would start with oral finasteride at 1 milligram daily. Then if I experienced side effects, I would lower my dose to like half a tablet every day, then lower it again to 3 3 tabs every week, and if that is still causing too many side effects, I would consider topical finasteride at that point. I would not just jump into topical finasteride immediately. The data does not support that decision, in my opinion, at this current time. Now again, when you spray it, obviously you're going to spray it on the scalp. So the theory here is that it will not spread to other parts of the body and reduce DHT levels systemically, which should reduce side effects. The main hesitation for oral finasteride is its side effects like reduced libido and erectile dysfunction that I mentioned earlier. The thing we have to get right with topical finasteride, or else it's useless, is the exposure of finasteride. If it's too much, then it can still get into the bloodstream and lower DHT levels in the body, causing the same nasty side effects of oral finasteride. And it's very easy to overdo it when you're just trying to drop a few droplets onto certain bald spots on your scalp. And if you overdo it, obviously that makes topical finasteride not worth it at that point. A way to measure if topical finasteride is affecting DHT levels in your body is by doing a blood test involving DHT. For hair loss, we want to target DHT in hair follicles, not in the blood. I'm not aware of any way to test DHT in hair follicles, but we can test it in the blood very easily. So if you're suspicious your dose is too high, or you just want to make sure your DHT levels aren't going down in your body, then getting a blood test could be worth it for you. If you have any questions, please drop them in the comments and I will get to them as soon as I can. Thanks for watching.